Hi friends, Angie Hernandez, certified hypnotherapist. I'm here at the Indiana Hypnosis Center where bad habits don't have to be forever. Get rid of those bad habits with hypnosis. Hi. Hey, thanks for joining me on Try It Tuesday. We have a great series here coming up. My friend Lisa, she has, I'm going to look at my notes so I say it correctly, CRPS, which is a malfunction of the sympathetic nervous system, so that she's in constant pain, excruciating pain, and she also has other symptoms that go with it. And because of this condition, the people that have it, there isn't a cure. There isn't a cure, and they get inflammation. They often have a debilitating changes in their physiology, but I'll let her explain more about the way it's affecting her. And she's agreed to do 6 sessions. What I'd like to do with her, and what she hopes I can do with her, is to alleviate some of these excruciating symptoms that have kept her in a wheelchair now for years. So today we're looking to straightforwardly reduce her pain level. Here's our video. So hi everyone, I have my friend Lisa with me today. We're Facebook friends, we've never met in person, but we've communicated for a couple of years together. And one time we did an on-camera, it wasn't a hypnotic session, but I was teaching her tapping. Yeah. And the reason Lisa's going to be with us for Try It Tuesday, we're going to do 6 weeks worth, is for pain levels that she's feeling from CRPS. And Lisa, I didn't really know anything about this condition until I met you. Could you tell everyone a little bit about it?
CRPS, also known as RSD, is a rare neurological disorder, disease that affects your sympathetic nervous system, more specifically the sympathetic nervous system. And basically, the best way I can describe it is that I am stuck in like fight or flight mode. I am stuck in the fight mode constantly. My body is fighting off everything. The pain is so severe in my feet and ankles now. Sometimes my legs, but mostly my feet and ankles. It was just one foot when it began, and it spread to both and out to the ankles. Pain is just excruciating. It's the nerves just misfiring and going crazy in there. Mm-hmm. I'm in a wheelchair now. I've been in a wheelchair for 5 years. Yeah, it's just, it's a very debilitating type of pain. It also, it not only is it debilitating, but it has, there is deformation that has occurred as well.
Is that related only to the joints or other parts?
I'm really, it's like my whole foot, the way my foot is completely deformed.
Okay.
The appearance is deformed. So I don't know if it's just the joints. It's the bones that are moving is what essentially is that it is.
But it's related to the other bones, so it's moving, deformed. So you don't walk at all?
I walk a little bit. When I do walk, I have to walk on the outsides of my feet. Mm-hmm. People will walk on the, the soles of their feet. Mine are on the outsides of my feet with my pinky thumb, my pinky toes, not my pinky toes down on the floor. So I'm walking on that ridge on the outside of your foot.
Yeah.
I have to walk. And I can't walk very long distances. I can get to the bathroom and back, but I can't like go out and take a walk around the block. I can't walk to check the mail.
No, you wouldn't have very good balance, I would imagine.
No, not at all.
I have to say, I went in earlier today and I was reading a blog post from a woman with the same condition, and she was talking about her pinky toe spasming. Is that typical? Is that something that happens to you?
My entire feet all my toes will spasm out and they'll be stuck in this wretched position. Mm-hmm. And my feet will stay stuck like that. And sometimes my husband has to physically manipulate my toes back to where they are because I cannot move them back to try to get the spasms to stop.
Yeah. And is one side worse than the other?
The left side, the original side, is worse than the other.
It's more advanced, would you say?
Just pain-wise is more extreme. It's equal as far as the advancement goes of the disease.
Okay.
Just some days that hurts way more than the right foot, and the right foot never hurts as bad as the left foot can. Does that make sense?
Yeah, it does. It's like it started out, so it's kind of ahead of the race
Yeah, exactly.
in that way.
Yeah.
So is this completely confined to your feet?
Right now, yes. My feet and my ankles.
Knock on wood.
Yeah.
Okay. And the ankle, both ankles as well?
Yes.
Do you have deformity in the ankles?
No, I have, what is it called? Atrophy in both ankles.
Atrophy, sure. All right. And I ask you off camera, but I'll ask you so everyone else can know that had you ever been hypnotized before?
Without being pre-recorded, I have one time. It was in counseling, and it brought up some pretty tragic memories that I wasn't very happy with. But I have used your recordings that you've produced, the free recordings that you do, and they do help. They do tend to help. There's a couple other recordings that I've used before, and they help as well.
Mm-hmm. They give you some relief. That's
For
good.
the pain, yeah.
That's good. What else did I want to ask? What is your pain level today? 0 to 10, 10 that you need to be hospitalized.
Today is a pretty good day. It's about a 7.
About a 7. All right. Is that on both sides or more so on the left?
Both sides.
Both sides are what you would say is a 7.
Nope.
Okay. So before we do a hypnosis, I want to do a little exercise with you to maybe bring that level down a bit before hypnosis, because you did tell me off camera that sometimes you have a hard time when you listen to my recordings getting into hypnosis. And I'm not really sure if that's just because of what's happening that day is keeping your attention or the pain level's too high. When pain is too high, it's very difficult to relax enough to be in a good hypnotic trance.
It's also very difficult to concentrate on anything but the pain. So
Absolutely. It kind of makes you dumb because
it makes you like scatterbrain, like you just can't focus. You can't.
no, you're completely focused on the pain.
Exactly. And that's what's great about hypnosis and meditation is that it helps you to like what I say to my husband, I need to go reset my brain real quick.
Yeah.
Because that's what I need to do is
it's like
focus off of the pain and onto something else. And
it's like pushing that reboot button.
Exactly, on the computer. Yes.
Yeah. That's what we want to do. So let's see if we can bring that 7 down a little bit. If you could tell me 3 words to describe your discomfort right now, just off the top of your head.
Electrocuting, hot, and cold.
Shooting, hot, cold. Okay. Now again, 0 to 10, rate your discomfort.
7.
Still 7? Okay. And now tell me 3 more words that describe your discomfort that aren't shooting, hot, or cold.
I can't think of anything off the top of my head. Those are the best descriptions I can give. Achy.
Achy, okay.
Pressure.
Pressure. Okay. One more.
Tingling.
What was it?
Tingling.
Tingly. Mm-hmm. All right. 0 to 10, rate your pain again.
It's gone down considerably. I would say maybe about 4 or 5.
4 to 5, good. So now tell me 3 more words that describe your discomfort that aren't shooting, hot, cold, achy, pressure, or tingling.
That sums it up. I really can't think of anything else. Let's see.
Gotta think of something new.
Pins and needles.
Mm-hmm.
Throbbing.
Throbbing. Mm-hmm.
An electric, like.
Electric.
Like an electrical pulse.
Electrical. Okay. All right. One more time, 0 to 10, rate your pain.
About a 4 or 5.
Still a 4 or 5, okay. Now give me 3 more words to describe your discomfort that's not shooting, hot, cold, achy, pressure, tingly, pins and needles, throbbing, electrical pulse.
Freezing,
Freezing,
sweaty,
sweaty,
constrictive.
constrictive. Okay, 0 to 10 again, rate your pain.
It's about the same, about 3, 4.
About a 3 to
Yeah, a little
4.
bit, yeah. I guess
Yeah,
it's
so we've moved it a bit. I think that's, I mean, we could go on, but I think that's a pretty good level for us to begin hypnosis.
okay.
Well, that was a pretty good change just for speaking to me.
Yeah, it was actually. When I get distracted, the pain levels tend to not be as bothersome.
Mhm.
I know that's one of the biggest things. As long as I keep my mind busy, the pain does go down.
Yeah, absolutely. That's why visualizations are so good.
Yes.
Okay,
Can
so
you
let's
see me
just,
okay on there?
I'm sorry?
You can see me okay?
I can see you well. I see you
Okay.
from about here up as you do me. Yeah.
Okay. Okay. Because the little picture of me is so teeny tiny that I wasn't sure.
Oh, you're really small on my screen. Maybe you can do it on your screen. On my screen, where did I find that button? They're side by side equal.
Oh,
I
I
have,
don't need to see myself. It's fine.
okay. I had to ask because I did one the other day and only the person speaking was on screen.
Oh,
So I did a whole hypnosis and recorded it, but we couldn't see the other person.
oh no.
I had to ask them today how to do that. So yeah, today we're side by side on my screen anyway. That'll work.
Okay.
Okay. Ooh, itchy eyes. The cottonwood's flying.
Oh boy.
All right, so we're gonna get started. You're used, because you have my recordings, you're used to my voice and relaxing. So when you're ready, you can just close your eyes. And I want you to imagine, if you can, what it would look like if you could see inside your feet. Wonder what's happening inside your feet. What does the structure of the bones look like now? What are the muscles? What are they like right now, the muscles and tendons? And if you can imagine those, imagine them relaxing and letting go and unwinding. And as you visualize and experience that, allow that same feeling to move up into your ankles, just allowing all those muscles, tendons, and fascia to release and let go. And then allow the same peace and calm that's there to move up your body into your calves and your thighs and your hips, just letting go, unwinding, finding a calm and peace that's right for you. And now let that same feeling move up into your hips and your stomach and chest. And imagine in your spine that all of the interwoven muscles and tendons that are attached to the spine, that they begin to relax vertebra by vertebra up your spine, slowly letting go and getting comfortable and peaceful. And let that same feeling of calm and peace move into your shoulders now, just letting go of any tightness and tension that might be there. And allow that now to move into your neck. We carry a lot of tension in our neck. Just let that release. Imagine all those muscles that we've thought about getting limp and loose like overcooked spaghetti. A big old bucket of loose spaghetti. And now let that same feeling move up over your scalp. Release all the muscles in your face, the forehead, the tiny muscles around the eyes, your cheeks. Just let your jaw be slack in a way that's comfortable for you. And as you inhale, I want you to inhale, Lisa, the color of forgiveness. Inhale the color of forgiveness and allow that to come into your lungs. Fill up the lungs, mix with the blood, and allow that to circulate throughout your whole entire body. The color of forgiveness. It's going out to every single cell in your body. We're going to create a new download of a new software called Color of Forgiveness. And as it goes out to every single cell, you can feel it relax you even more. Even more. That's right. And just let that feeling now move from your shoulders down to your hands and fingers. As we go down at 5, just taking note of your breathing. Noticing if it gets slower, deeper, more rhythmic. Just take note of that. At 4, find that feeling of buoyancy. Buoyancy as if you were floating in the ocean or in a pool. Or just imagine if you could leave your wheelchair and float on a cloud. How great would that feel? Or even just float on a current of warm air. Yes, that would be delicious. At 3, as you're inhaling the color of forgiveness, I want you to exhale the color of blame. Exhale the color of blame, and as you exhale that color of blame, you see there's more room in your body for the color of forgiveness. And just allow that color of forgiveness to fill up every single cell of your body, downloading this new program, Complete Forgiveness. And as you're completely filled with it, the excess will spill out the top of your head and be absorbed through your feet until you have the color of forgiveness within you and without you, just passing back and forth within and without, like smoke through a veil. Good. At 2, turning inward to that part of you that knows you so well, that knows everything about Lisa. At 1, going down, 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 all the way down, and 0 is deep sleep. Deep sleep, and go twice as deep, Lisa. Each and every time I'd say deep sleep for the purpose of hypnosis, with your permission, you'll go to this depth or even deeper. Or even deeper. That's right. You're doing it right. You always do it right. And now I want you to imagine, picture, or pretend that you're in your favorite place in nature. I don't know if that might be by the ocean on the beach, or there might be a botanical garden, or just a place you like to go in nature. Might be just around your house. Or if you can imagine, it might be an imaginary place, like climbing a mountain trail, an imagined place that you love. But wherever you are, whether it's real or imagined, imagine that you hear those birds, whether they're seabirds or your local birds. I know your local birds, there are sparrows, there probably are some pigeons. You know, if you're in that imaginary place up on the mountain, you might hear a hawk call to its mate. But wherever you are, you're hearing the birds. And I want you to imagine moving into this place. Let's take 10 either steps if you're imagining yourself walking and whole, or just wheeling in your wheelchair. I'll count from 10 and you move 10 imaginary paces into it. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0. Deep sleep. Each and every time I suggest deep sleep to you, for the purpose of hypnosis with your permission, you'll go to this depth and the physical body will relax. That's right, that's perfect. Now just imagine, if you can, Lisa, if you can imagine what it might be like if you were to go into a surgery. And I don't know if you've had surgery before, but I'm betting you know what it might be like. And we're not going to do a surgery today, but I'd like you to imagine how it feels when you go into a surgical room. First, you're lying on the gurney, the bed with the wheels, and you're in one of those lovely hospital gowns. And they're wheeling you down into the surgical arena or theater, where everything's bright white and stainless steel and lots of lights. It's all very bright and clean and sterile. When you get in there, you may hear the doctor speaking, the anesthesiologist, the nurses, but the nurse that's by your head, she'll be talking quietly to you. And if you were to have a surgery, you may already have an IV in place, where they maybe have given you a little bit of a drug that helps you to relax. Not sleep yet, but just relax and take away the nervous tension. But as they want to anesthetize you for a surgery, what they'll do is they'll ask you to either breathe in a gas that helps you to sleep, or they might inject a drug like propofol into your bloodstream through your IV. Propofol just helps you forget the procedure. Let's just imagine that you had either an injection or you're inhaling the gas, and they might ask you to count backwards from 100. So let's just imagine that's happening. Just count slowly backwards from 100 right now. And you can do that out loud.
24, 23, 22.
And as you say those numbers, you see them pass in front of your eyes, like they're written, and they're passing like a cloud passes. That's right. And then they disappear. And in a couple more numbers, all the numbers will fall away.
6, 5, 4.
Now all the numbers can just fall completely away. That's right. That's right. Perfect. Now, Lisa, what I'd like to do is speak directly to your subconscious mind. So if you would, let's allow your conscious mind to go to a place where it can relax and be at peace. And you can decide where this is. This probably is a place you've been before, or maybe you just had a relaxing afternoon. Let's just allow your conscious mind to go there. And we'll allow a big bubble to surround it, to protect it, and allow it to just be calm and peaceful there. But I want to speak directly to your subconscious mind today. And I'd like to ask your subconscious mind to imagine that a cool healing gel has been applied to your feet and your ankles, all the way around, all the way between the toes, and around the edge of the foot, up around the ankle. And just give me a little head nod when that's all been applied. Good, very good. And you can give me a head nod again if that's giving you relief. That hypnotic gel. Good. You can feel it there. And now I'm going to ask your subconscious to also allow some tiny work people. There might be workmen or workwomen in their little coveralls to be inside of you, down in your bloodstream. They're the construction crew. And their job is to go all the way from the brain nerve center. They're going to be sent out into the field. They're going to be sent out through your complete nervous system, all the way down into your ankles, feet, and toes. And they're the construction team. Their job is to go along each nerve from your head all the way down to your toes and rebuild any spots that have blockages, straighten out any nerve connections that are bent or crossed incorrectly. And also, what they might need to do in some places is the nerve itself might just be squeezed too tight. And so the signals that are passing through it are very uncomfortable. So what they may have to do in some places, they may have to stretch out the sheath of the nerve to allow it to be a bigger diameter to pass through all the signals comfortably, so that you feel comfort along all these nerve shafts all the way through your body. And they find relief down in your ankles and down into your feet and toes. Right now, they might have blockages. There might be parts that are bent. Some might be crossed and firing incorrectly. In some, the diameter might just be too small, and it needs to be stretched out so that the signal can pass through more comfortably and more of the relief signal can pass through correctly. And so if we will allow these work people to go all the way down through your body, out into your feet and toes. And I'll just ask your subconscious to give me a little head nod if those work people are in place. Good. Very good. And now what we'd like them to do is to go ahead and work on this nerve system. We know that the nerve system is quite extensive. It might take a while for the nerve repair to be completed. So we're not going to ask your subconscious and give it a deadline. We're going to ask it to continue the repair even when you and I are finished here, over the next few hours, over the next couple of days. And what suddenly might happen is, Lisa, you might just notice maybe in the morning or maybe in a couple of days that those nerves are firing better, that your feet are feeling more the way you would choose them to be, more normal. The nerves seem to be beginning to act properly. And that's going to be the work of your inner workman. In the meantime, I'd like to ask your subconscious if it would give permission for some pain relief to be moved down into the feet and the ankles. You can just give me a head nod if that's okay. Good. So what I'd like it to allow is I wonder if Elisa has ever had Novocaine and that made her jaw or her teeth numb, her gums numb. Yes? You know that feeling of Novocaine where it gets very, very numb and there's no pain when the dentist works? Just give me a head nod if you have had that sensation. Okay, good. So what I'd like you to do now is to remember that sensation of numbness and Novocaine and just allow that to come up into your jaw just for a moment or two. And you may want, if it's helpful to you, you may allow your finger to come and tap gently on your jaw to stimulate that sense of numbness. Just allowing it's numb, it's cold, cold and numb and cold, cold and numb. Are you feeling it numb and cold now? That's good. Is it very numb and cold now? Just give me a head nod if that's correct. Good. So now we're going to do a little exercise. I want you to move the numb and cold feeling out of your jaw and let it go all the way down to your fingertips. Just move it from your jaw, let it stream down all the way to your fingertips until your hands are beginning to feel numb and cold, cold and numb, numb and cold, cold and numb. Yeah, good. Just give me a head nod when your hands are feeling really cold and numb. Good, good, good. So what I'd like you to do now that the sensation is in your hands, let's move it again. Let's move it all the way down to your feet and toes. Moving, just allowing it to flow like a stream, flow like a river from your hands down to your feet and your toes. Cold and numb, numb and cold, cold and numb, numb and cold. Very strong, numb and cold, cold and numb. We want to allow this sensation to be in your feet and toes over the next few hours, maybe through the night so that you sleep well. It should be getting stronger and stronger so you're feeling the relief. Just let me know when that has really made your feet cold and numb so that you feel the relief. Good, very good. I'd like you to, subconscious mind, I'd like you to allow Lisa to have the sensation for a few hours, maybe through the night. I don't know which you would choose, through the night or for the next few hours. Just allow her to have this relief for a while this little inner workman makes some changes to the nerve endings from her head to her feet. Yeah, would that be all right? You choose the time period. Yeah. Now, I don't know what would be the most important over the next few hours or day or 2 or 3 days. Whether it's more important to you to feel the nerve sensation come back to life in a normal way, or maybe feeling the numb and cold pain relief for a period of time while the work is done, or maybe kind of the crazy but insane and great way your feet are responding to the work that we're doing. I don't know which of those is more important, but you'll know. And I'm going to say this, that over the next few days, even though you might not believe it, something very important is going to be happening inside of you. There will be changes, physical changes being made, but also mental changes being made. You're going to feel more confident about yourself. You're already a confident person, but you're going to feel more confident because of the physical changes. And you're going to be less worried about what might happen in the future. You can count on yourself and how the repairs and the changes to the nerves will happen. This is all going to happen kind of behind the scenes. You'll just suddenly notice that you feel better and that it's great. And you can move a little bit more. Just move a little bit more. And that's going to feel wonderful. Yeah. All right. So we're going to allow this work to continue behind the scenes like a download on a computer. You begin the download, you can walk away and do some other chores because it takes a while for it to download. This one's a long download, so it's going to take a while, but that's all right. It'll just be happening behind the scenes. Okay. Now at 0, you tend to slip a little deeper. At 1, beginning to notice as your body is in the chair, feeling yourself, the weight of your body in your chair. At 3, Lisa, take a deep, deep breath. Deep breath. 4, becoming very alert. 5, eyes open, wide awake. 1, 2, 3, 4, 5, eyes open, wide awake.
Oh my gosh. I almost slipped out of the chair.
You were really, really relaxed.
Oh, I feel like I just took a really long nap.
You know, they say 10 minutes in hypnosis is like a 2-hour nap.
It feels like I've been asleep for hours, yeah.
How long do you think that was?
At least an hour, hour and a half.
I didn't look at the clock when we started, but I think, what was it, maybe 15 minutes?
Oh, wow.
Maybe 20? I'm not sure. I'll have to look next time. Yeah, time is very distorted in hypnosis. How are you physically feeling?
Right now, my feet, there's very little pain in my feet right now.
That is awesome.
It's an annoyance more than a pain, if that makes sense.
And annoyance can be handled, can't it?
Yes, like I can actually move my feet and they don't, like I'm moving them right now and they don't, it's not like that, don't do that again type of feeling. It's like, it's a little bothersome, but wow.
That's awesome.
It's a huge, huge difference. Thank you, Angie.
Oh, you're welcome. So what I'm going to give you homework.
Sorry.
I'm going to give you homework. I always give homework. Now, I didn't make a special recording for you because I wanted to work with you a little bit first. But I'll probably have one ready for you next time because I know you have some recordings of mine, general recordings. It's fine to listen to. And I know that you use them, so continue to do that. That is fine. Okay. But I'd like you to work on a little, and you might already do this, a little meditation every day. Take that step back. Yeah. Take that step back and imagine and picture and pretend something out there that distracts your mind, takes you out of your body. And
I meditate in the morning to focus my day, and then in the evening to help me relax to go to sleep.
That's great. That's perfect. Keep that up.
Mm-hmm.
And if you want to think of some more words, you can. Okay. You need them again. Actually, I went a couple of days ago to the bank, and the teller had a migraine, and I did the exact same thing with her and brought her migraine pain down to a 0.5. So
that's awesome.
Yeah, it's a super technique.
Yeah, if I have to say, it's hovering between a 1 and a 2. So with the pain, so that's a huge relief.
Awesome.
Wow, that was just so impressive how well she did. And you know, she later on texted me that she still was feeling pain relief, and it had been a couple of hours later. So I was so impressed with how she took to the hypnosis and so grateful at how much it helped her. These are the kind of things we can see in hypnosis change. And hers is a long-term disease, so we're going to keep going and seeing just how much we can affect her. How my point is to try to get her back to a daily life that's livable and not in total pain and malformation day after day. Hypnosis has proved in some cases to be very effective for this disease. So stay tuned on Try It Tuesday. We'll be going forward with Lisa every Tuesday. This is the first of 6 weeks. And if you would like to have free hypnosis with me on Try It Tuesday, I have a waiting list going, and I'll take you. I'm just looking for different kinds of things that people would like to work on. You have to agree to let me put you on camera and put you on air, but I would love to do it. So follow me, if you will, and you can go over to my site, indianahypnosiscenter.com, and I'm writing about mostly weight loss and hypnosis for children, but other things too in my blog. Follow me there and get lots of new information, and you can get a free hypnosis from me just for subscribing. So until next time for Try It Tuesday, see you friends. This one's from me to you.